Right, thank you for those global tallies, Soa. Here in the country, as Soa mentioned, the tragic losses of daily lives amid the onslaught of Omicron are fueling much concern. For more, Shin Ye-EUN joins me now. Ye-EUN, welcome back.
Great to be here, Sunny.
Right, so let's begin with the alarming number of COVID-19 fatalities here in the country.
Sure. So since the Omicron surge began, we've seen an alarming rise in our death toll. In a span of just 1 week from March 11th to 17th, Korea has reported more than 2,000 deaths, and the number of critically ill patients has remained above 1,000 for the 17th consecutive day. That's why many medical workers are now reporting burnout and exhaustion from handling the spike in patient loads. However, what's perplexing is that health authorities are portraying a much different picture in regards to the state of our medical capacity. They're saying our healthcare system remains stable and that we're doing a much better job of managing patients compared to the Delta surge, as we still have a spare capacity of over 30% in our ICU beds. But many in the field have pointed out that the government's method of assessing medical capacity shouldn't be based on the number of hospital beds available for COVID-19 patients. And this is because hospitalized COVID-19 patients are transferred to regular wards after a week, according to current treatment guidelines. These patients are not included in the country's total tally of severe cases. In other words, medical workers say that the number of patients they're required to look after is much higher than what the government's official tally might suggest. Take a listen to this medical professional who represents a union of Korean healthcare workers.
We're trying to prevent the situation from worsening, but we're reaching a limit. Our emergency rooms have partially closed countless times. I don't know how we came this far with so many crises.
Right, and Ye-EUN, what are authorities doing to address this burden faced by our healthcare workers?
Well, to relieve the burden on hospitals providing monitoring and phone counseling services to home recovery patients under intensive management, authorities have decided to narrow the criteria on who is eligible for these services. The country has some 270,000 patients in the intensive management group who are seen as high risk and receive 2 daily health checks from medical staff. They are seniors aged 60 and up and the immunocompromised. From Friday, people in those groups will need a positive PCR test result to be eligible for an automatic placement in the intensive management group. But like others in the standard management group, they can call their nearby hospitals and ask for a drug prescription if needed. For those over 60, Paxlovid is also available, and they can make a request to be placed under intensive management if they wish. Also, health authorities proposed on Wednesday to hand out new incentives to clinics or hospitals treating COVID-19 patients. They said hospitals can receive extra evaluation points at future reviews of their performance if they're effective in providing emergency care to COVID-19 patients.
Right, I see. Yeah, and meanwhile, the World Health Organization, I understand, has published a report showing that Korea is now the current epicenter of the latest Omicron outbreak.
That's right. The global health body named Korea as the country with the world's highest number of new COVID-19 infections for the 3rd straight week. In a report on Wednesday, the WHO said that the world added more than 12.3 million new cases from March 14th to 20th, which was a 7% jump from the week before. And Korea took up more than 2.8 million of those cases, which was by far the largest tally yet. Next in line is Vietnam, which recorded over 1.8 million new infections. Germany logged 1.5 million and France reported some 580,000. We've seen the number of new infections in the Western Pacific alone go up by 21% in a single week. And the silver lining here is that the number of global deaths from COVID-19 fell by 23% from a week ago.
And hopefully that reality will be reflected here in the country in the near future. Ye-EUN, as always, thank you for that. I'll see you on Friday.
Thank you so much.